Because the World Health Organization says a decision by some countries to refuse entry to people who have been vaccinated with a vaccine that has WHO emergency listing is creating chaos and heightening apprehension. Director General of the World Health Organization, Dr. Tedros Adhanom Ghebreyesus, says the situation is creating confusion and discrimination. During the weekly press briefing, Dr. Ghebreyesus assured vaccines that have received WHO emergency use listing are safe and effective in preventing severe diseases and death, including against the Delta variant.
People are dying who should not be. More than 50,000 people have died with COVID-19 every week since October last year. And for the past month, deaths have remained at almost 70,000 a week. We have the solutions to stop transmission and save lives. But those solutions are either not being used well or not being shared well. While cases in some of these countries are increasing among unvaccinated people, hospitalizations and deaths have remained relatively low, thanks to vaccines and earlier clinical care. However, premature relaxing of public health and social measures is putting unvaccinated and immunocompromised people at extreme risk. Meanwhile, countries with low vaccine coverage continue to see high case fatality rates. Some countries are refusing entry to people who have been fully vaccinated with a vaccine that has WHO emergency use listing, but which has not been approved by their own national regulators. This is creating more chaos, confusion, and discrimination, with some countries even refusing to use certain vaccines because of concern their citizens will be denied entry to other countries.
So you have the Director General of the World Health Organization, Dr. Tedros Adhanom Ghebreyesus. But let's paint you a picture of a COVID situation in Ghana. According to the Ghana Health Services COVID updates, new cases 180 as of the last update sometime 2nd September. And out of those, there are critical condition. Those who are in critical condition are 51. And then 129 others have severe ailment. The cumulative active caseload is now 5,779. And the death toll has since shot up to 1,084. And all 16 regions, according to the latest updates from the dashboard, have active cases. So that's the latest picture when it comes to the COVID-19 situation in Ghana from the COVID-19 dashboard of the Ghana Health Service. Still on health, the Democratic Republic of Congo has declared an outbreak of meningitis in the northeastern Tosho province with 261 suspected cases and some 129 deaths. Health authorities have deployed an initial emergency team and WHO is supporting the response. We know that more than 100 patients are already receiving treatment at home. Here is the updates by WHO Country Director Dr. Tedros Adhanom Ghebreyesus.
The Democratic Republic of the Congo declared an outbreak of meningitis in the northeastern Shopo province with 261 suspected cases and 129 deaths reported. Health authorities have deployed an initial emergency team and WHO is supporting the response. More than 100 patients are already receiving treatment at home and in health centers. WHO has provided medical supplies and plans to deploy more experts and resources. Meningitis is a deadly and debilitating disease with serious health, economic, and social consequences. Later this month, WHO and our partners will launch the Defeating Meningitis Roadmap, the first global initiative to address this devastating disease. The roadmap has 3 key objectives: ending epidemics of bacterial meningitis, like the one in DRC, reducing bacterial meningitis cases by 50% and deaths by 70%, and supporting survivors to address disability and improve quality of life.